In and out through your mouth, nice and slow.
Pulmonary fibrosis is a set of diseases that cause progressive scarring inside the lungs. Over time, healthy tissue is slowly replaced with scar tissue, which causes airways to be blocked, restricting airflow. This makes breathing difficult and chokes off the amount of oxygen needed in the bloodstream.
Only 29% of the population have ever even heard of the term. And of that 29%, 44% have heard of the term but know nothing about the disease. That's such an important part of it.
Experts do not know exactly what causes the lungs to scar in people with pulmonary fibrosis. But there's one thing they do know. What most patients experience first is shortness of breath. 61-year-old Dolores Eckert thought that her shortness of breath was due to her lack of exercise and just being out of shape.
We wanted to go to this replica of an old Irish village which was up on top of this hill. So we started walking up, and before long I was really winded and I had to stop to catch my breath. Well, I never thought I would get up to the top. And we were just talking about what a physical mess I was because I wasn't out walking and exercising.
Experts are just beginning to understand the process behind pulmonary fibrosis.
What's happening in the lung is similar to what's happening in other parts of the body when there's a cut on the skin or there's some kind of injury, and the body responds to that cut or that wound by trying to heal it. But the lung responds abnormally or does not heal the wound correctly. It keeps laying down scar, which is part of the normal healing process, but it doesn't stop. It keeps going and going and going.
You still hear your crackles at the right base.
Doctors will listen for specific sounds in the lungs to identify pulmonary fibrosis. Further tests are then conducted to confirm the diagnosis. In addition to a CAT scan, Dolores also received a pulmonary function test.
That's it, normal breathing, normal breathing. Now this time, big breath in. Now blast it all the way out, all the way, go, 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 go. Keep going, keep pushing, you're almost there. Big breath back in, take it all back.
The role of pulmonary function tests is integral in making the diagnosis because you should see a specific pattern. You should see that there isn't as much lung capacity as a person otherwise should have, and that the ability to transfer oxygen is impaired.
Steroids and oxygen therapy are common treatments for pulmonary fibrosis patients, but these therapies have not demonstrated to be completely effective, so new treatments are now being tested.
The current line of thinking is to go with medicines that are specifically for fibrosis, these anti-fibrotic medicines. That's undergone the most testing is interferon gamma, which is a naturally occurring substance in the body.
Dolores is participating in the largest randomized placebo-controlled trial evaluating a therapy in idiopathic pulmonary fibrosis that's ever been done.
So to help Dolores cope with the challenges that lay ahead, she began a pulmonary fibrosis support group in the small town of Lee in the Berkshire Mountains of Massachusetts.
I soon realized that I wanted to start my own support group in the Berkshires, because if I had this disease, there must be a lot of other people here with it. Some of them must feel like I do. So finally I went and I called the Berkshire Eagle and I called the Berkshire Record, and I asked if they would print my story, and they did. And from that, the people called me. And it's been very rewarding, and I love it. I think this is the best thing I've ever done.
Patients and experts are optimistic about the future of those diagnosed with pulmonary fibrosis.
And there's a very concerted, sincere effort to really find not necessarily a cure for the disease, but drugs that really will help prevent the progression. Ultimately will allow people to live relatively normal, longer lives.